Hey guys, looks like I'm gonna be going home. Thank you for all the prayers. I just got dressed. I just put on my gown. I have my mask here. I'm still here at the hospital, trying to get some food down, trying to eat something, and I should be going home soon. I couldn't talk yesterday to let anybody know, but I'm like on the edge of the bed. I kind of sat it up all the way, kind of made it rise, and I'm kind of leaning on it because the pain is unbearable in my lower back. But the good news is they did an MRI and they did a CT scan, and they found a little bit of bulging in the lower back, and I can't even think of the words right now. I need to look at the paper. I'm sorry, guys. The doctors have been really nice here, and all the nurses have been super nice. They wanted to send me home last night, and they wanted me to have my husband come pick me up, and I was like, there's no way. I can't go home. Like, I can't even sit down. If you want me to go home with all those meds, then you need to send an ambulance to come and pick me up, because I cannot sit down for the life of me. And I was crying and crying, and the doctor finally decided to admit me, and so they brought me up to the 7th floor. So I've been here all day. They had the booties on me so that I wouldn't develop any blood clots while lying down. But I couldn't even do this yesterday. I couldn't even sit on the side of my bed. I couldn't even move my legs up the way the doctor wanted me to. Rolling to one side or rolling to the other so that they could put the flat board on me was, it was just so much pain. But it looks like I'm gonna go home, so I'm happy about that. I get to be in my bed, but scariest feeling ever. And lots of pain. Right now they came in, they put an injection on me. The Toradol. It's like a pain med or relaxant. I'm not sure which one it is. I think it's the pain med, and it really burns. But they said that would really help me, so to at least be able to get home, because the bumps going home is gonna kill me. That's but anyway, I'm gonna go home. Hubby wasn't able to come with me, as you know, the whole quarantine thing, so I've been by myself. Let me come and check to see if you guys are sending any messages. Thank you, Maria. Prayers really, really help. I appreciate all the comments, guys. Thank you so much for taking the time to pray, and I think that's exactly what I needed, because yesterday was horrible. Today, I can sit. The CNA that came to help me this morning, he's a really big guy, and he's so sweet, so nice, and he's like, just support yourself on me, and he took his time, and he placed me in the restroom while he fixed the bed and everything, but he brought me back, and he sat me down, and today was the first I could do that. I couldn't do it yesterday. I was like so bloated, and I couldn't even pee. My husband put a diaper on me because I had to pee, and I couldn't get up from the floor. So he would put a diaper on me, and as much as I tried to push and tried to pee, I couldn't do it. So they ended up putting a Foley in me yesterday in the emergency room, and then finally I got relieved from that. But that was the pain on my back. I had so much to go and pee. It was just, and I had to wait for about 5 hours before they would put a Foley in me. Anyway, but good news is I'm going home, and Hubby's coming to pick me up right now, so he should be here like in around 20 minutes. And then they'll go ahead and take off the IV from me. I'm just glad nothing's broken, even though it sounded like it. I just felt a crack. I had gone into the shower, shampooed my hair, conditioned my hair, had shaved one leg. But I don't ever bend over all the way because I know I have an injury on my back. I know what my limits are. So I always lift my legs to the top of the tub. And when I did that to my left side, because I was going to continue to shave, I had my leg up and I was shaving. I bent down a little bit to shave, and then I just heard a crack in my back. It wasn't like a pop, like kind of like when you try to move side to side to pop your back. No, this sounded like a crack. It was like that. And I just went down after that. The pain was terrible. I tried to lie down and thought maybe that would help. Maybe that would kind of put things back in place, which was worse because I was trying to call my kids, trying to yell their names, and they wouldn't hear me because they were in the other room. And my restroom has double doors, so it has the first door and it has a second one to the shower and the toilet. So one of the doors was closed and they couldn't hear me. So I decided to get something to throw at the wall so they could hear something. And I was hoping I was going to make a hole in the wall, but I threw it as far as I could, made a loud noise, and then I yelled my husband's name super loud. And then he came and he's like, "Babe, what happened?" And I'm like, I can't get up. And I just started crying. And I was like trying to calm down because I know how my husband gets when there's a stressful situation. The kids were crying. "Mommy, what's wrong?" And then we called my brother, my older brother, and he told me to take some pain meds so that I could try to get myself out of the shower. I didn't want to call the paramedics. I didn't want them to see me all naked, and then they were going to probably have to remove the doors from the glass doors that are from the shower. They have 2 double doors, sliding doors. So I said, no, like, I need to get out of the shower. So I put myself in a kneeling position, and the sliding doors, they have like a metal at the bottom where they slide. So we put some towels there, and I just tried my best to crawl out, but it was so much pain. So what I ended up doing was thinking just like throw myself over, like just so that I can be on the floor. So I did. While I was trying to do that, my husband, I got one leg out, and then he pulled up my other leg, and it was so painful when he tried to lift my other leg to get me out. And then I just stayed on the floor. And it was so much pain to try to use my arms and my hands to move. So I just tried to use my knees and my, because I couldn't push myself with my feet. There wasn't any way. So I crawled as much as I could on the floor, wet and cold. And I told my son to put a towel underneath me. So my son and my husband helped me put a towel underneath me. And then my son, because my husband's blood pressure started going down. And so my son is the one that helped me pull me out of the restroom with a towel. He would pull, and I would just pull with him, like kind of try to pull myself so that I wouldn't hurt his back either. So my little boy was my savior yesterday. And my brother, then he came and he took over. And my brother's a big guy, so I knew he was going to be able to help me more. He got me to a point where he could lie me flat on the floor. He put some sheets, and bed sheets, and that's how he was able to drag me to the bedroom. In the bedroom, I lied down for a little bit on my back, and he would tell me to see if I could move my neck, see if I could move my feet. I could move my neck. I was able to move my feet at the time. I couldn't raise them, but I could move them like from side to side. So he's like, I don't think you're broken because you wouldn't be able to do any of that. I'm like, no, I know, but I did hear it crack. And so after, I think it took us about 3 hours before we called the ambulance. And then that's when the ambulance came. And while I'm grateful, they did hurt me a lot because they didn't want to put me on the board. They ended up just using sheets to pick me up onto the stretcher. And that really, really hurt. I would have preferred the board, but they used sheets and got me on the stretcher, and then they brought me here. So that's what happened yesterday, and I was perfectly fine yesterday. I was doing my exercise on the exercise bike. I was walking around fine, but I did have a gut feeling that if I went into the shower, something was like, I had a little gut feeling like I knew something was going to happen. I had it, but I was like, I needed a shower. You know, I had been sweating from doing the exercise, so I wanted a shower. And right before I got in the shower, I felt like a little chill. I was like, nah, I'll be fine. I told my son to lower the AC. I thought it was just that. And no, little did I know I was going to end up in the hospital. So I have to be trying to get up on my own, but slowly. He told me he wants me resting, no exercise right now. He's going to give me a muscle relaxant, and he's going to give me he told me I could take ibuprofen if the pain was a lot. What else? And that's it, just the pain med and the muscle relaxant. And I have a follow-up to see him again. If it continues to be a problem, then they told me to try to see if I could see a neurosurgeon, and they gave me the name and the office number to a doctor that's a neurosurgeon, because they deal with the spine. So they found some bulging, and he said another word, degenerative something. I guess when you get older, it starts deteriorating or something, or dehydrating somewhere in the discs area. So yeah, guys, that's what's been going on. I'm just trying to finish eating real quick, and I'm dressed. I'm just gonna wait for hubby to come pick me up so that they can wheel me down and take off all this stuff and head home. Anyway, sorry. I look like a total mess. Haven't been on here for a long time because I've just been dealing with the kids, with homeschooling, and anyway. Okay, guys, I just wanted to thank you so much for all your prayers. I appreciate it. Probably going to be seeing my chiro again, my old boss, Dr. Romero. Hopefully this goes away. He had to attend me last year for something similar. This one was worse because it actually heard the crack. Last time I was mopping. Missionaries were going to come over, so I was cleaning up. And I was mopping, and I threw out my back, and I couldn't walk. I couldn't do anything. It was so much pain. I had gone to one of the small ERs in Edinburgh, and they had given me just pain meds, did some x-rays, and they said I was fine, and they sent me away. So had to see Dr. Romero so that he could help me, and he adjusted me, and he helped me, and he got me walking again. So he's truly God sent. And so I'm probably going to be seeing him again for this. Anyway, guys, I'm going to finish trying to eat because hubby should be coming soon. But I wanted to thank you guys for all the prayers and for everything. And I'll talk to you guys soon. Bye, guys.